has identified the cause of the
mysterious new virus,
coronavirus.
We now have a name for the disease, Covid-19.
Assalamualaikum and hi to my beloved lecturer Mrs. Rohana and all my classmates. My name is Syahida Binti Ahmad from BA2353B. Through this video, I would like to explain the implication of the COVID-19 outbreak on healthcare operations. So let us get started. Healthcare operations are about the management of interconnected processes or system. A system is a set of connected parts that fit together to achieve a purpose. So healthcare operation and system management are diverse and interrelated activities that allow for diagnosis, treatment, payment, and administrative management in healthcare facilities. Since the COVID-19 pandemic hit the world, all we can say an epidemic has generated a shot of unsustainable demand for capacity-constrained healthcare system, and it may result in increased poverty and reduced access to healthcare far beyond COVID-19, especially in low and middle-income countries. Since COVID-19 is officially recognized as a pandemic, the World Health Organization (WHO) has focused on flattening its infection curve, vital to saving life and combating and protecting healthcare operations and services. Among the main reasons to flatten the COVID-19 pandemic infection curve are: first, to prevent the occurrence of high mortality rates. Second, delaying the effect of a pandemic on healthcare operations. Third is to buy time or open up opportunities for healthcare organizations and other manufacturing and service organizations to reorientate their supplies, chains practice well, and be able to meet every demand. Pandemic have had unintended effects on healthcare operations and have indirectly affected patient resource utilization, capacity, and demand. This has forced healthcare capacity to deal with high and unbearable demand. To protect healthcare, we must identify the most critical part, which is the implication for demand, resources, and capacity. We must know to delay the impact of increased demand that has occurred during the COVID-19 pandemic. Did you know? The ever-increasing number of patients in hospital has created an operational bottleneck. At the same time, it has also increased the use of high capacity in healthcare organizations so that there are long queues of patients who have to wait to receive treatment. To address the unsustainable increase in infected patients, hospitals should significantly increase their capacity. Therefore, we need to increase the healthcare capacity by reorienting healthcare supply chain practices well. When we return to the basic of factory physics, the increased demand will directly affect the limited healthcare resources such as equipment, materials, and medicines. For example, as we know that bed capacity plays a vital role in managing COVID-19 patient demand. By knowing that, we can reorient healthcare supply chain practices by using ways to maximize healthcare facilities, either to address the issue of inpatient arrival rate variability or minimize the issue of process variability in healthcare supply chain. After we increase the capacity of healthcare resources, we need to manage demand and capacity by using lean practices. So what is the role of lean practice? As we know, lean is a set of operating philosophies and methods that can help create a maximum value for patients by reducing wastage and waiting time. It has proven effective when many countries have prioritized lean in healthcare. This is so because lean places great emphasis on customer needs, employee engagement, and continuous improvement. And lean also offers opportunities to manage demand, improve the quality and safety of care, and reduce operating costs. In turn, Lean can be used to manage and increase capacity, and it also supplies support staff in redesigning and processes and maintaining meaningful change that breaks down hierarchical barriers. Examples of principles and tools used in Lean training came to fruition when the UK NHS started offering complete healthcare services and using Nightingale Hospital to treat COVID-19 patients. One of the fundamental principles of the Lean production system is through close cooperation between buyers and suppliers to maximize the delivery of value to end users. This principle is seen to have been widely and well adhered to during the manufacturing process of ventilation equipment globally. By using Lean, we can improve quality across healthcare operating system and the supply chain. To improve quality, we must address this supply chain issue in the long run through active cooperation between the public, private, and the third sectors. Other options are to invest in resources to increase capacity in the mental health units that are already struggling with the staffing issues, including a shortage of clinical staff and lower management rates, staff with serious illnesses, staff who have died and are not replaced, and staff are unprepared to work because of safety concerns. This problem has hampered healthcare operation. The hospital can recruit new employees, especially recent graduates, to fill the vacancies left through this investment. Maybe a few suggestions for research can be applied by the healthcare organization to manage any issue that emerged during this pandemic. This COVID-19 pandemic has forced every healthcare organization such as the NHS to rethink and restructure their supply chains, procurement operation and models, create capacity planning, implement demand management and patient-centered care at the community level to address the operational dilemma demand versus capacity. Therefore, we encourage research that we investigate several areas of demand management in healthcare. First, based on the global impact caused by the epidemic, studies on healthcare resilience, including comparative studies of management performance of other countries to benchmark each best practice during the closure periods, are very encouraging and is a good move. Another area of interest to explore is how each healthcare organization collaborate with other industry in the public and private sectors to develop appropriate solutions for COVID-19 patient treatment procedures. It can also support healthcare workers. Finally, we support that COVID-19 is a modern disruption case study for OM teaching. It brings a new perspective of operation management and can be added to a supply chain management subject introduced for student learning advantage. In conclusion, we have discussed the various implications of the COVID-19 pandemic on the healthcare demand, resources, and capacity, and provided direction for research purpose. We also argue that this epidemic impacts the country's economy and operations and even affect the healthcare system. Therefore, healthcare organizations and government worldwide must fight for the leveling the infection curve to reduce infection and the mortality rates. With this, we suggest that the government and the healthcare organizations constantly evaluate their contingency plans to improve the way they address this issue by adapting the supply chains of equipment and the demand of affected patients while strengthening healthcare operations.